Senator Bernie Sanders, of ET, will release a proposal Wednesday afternoon to transition the United States to a single-payer healthcare system, one where a single government-run plan provides insurance coverage to all Americans. The Sanders plan envisions a future in which all Americans have health coverage and pay nothing out of pocket when they visit the doctor. His plan, the Medicare-for-all Act, describes a benefit package that is more generous than what other single-payer countries, like Canada, currently offer their residents. The Sanders plan goes into great detail about the type of coverage Americans would receive. But it provides no information on how it would finance such a generous healthcare system. Americans' taxes would have to change to pay for this kind of proposal. But it's impossible to tell who would pay significantly more for their coverage and who would pay less, and by how much. This is a crucial part of any health care plan, and in the Sanders proposal, it is notably absent. So while the plan would certainly move the American uninsured rate from around 8.8% to nearly zero in theory, it's impossible to tell what it would take to get there and what the bigger economic picture would look like if we did. The Sanders bill includes an exceptionally generous benefit package. Sanders's single-payer proposal would create a universal Medicare program that covers all American residents in one government-run health plan. It would bar employers from offering separate plans that compete with this new, government-run option. It would sunset Medicare and Medicaid, transitioning their enrollees into the new universal plan. It would, however, allow two existing health systems to continue to operate as they do now, the Veterans Affairs Health System and the Indian Health Services. Those who do qualify for the new universal Medicare plan would get 4 years to transition into the new coverage. In the interim, they would have the option to buy into Medicare or another publicly run option that does not currently exist. Eventually, though, they would all end up in the same plan, which includes an especially robust set of benefits. It would cover hospital visits, primary care, medical devices, lab services, maternity care, and prescription drugs, as well as vision and dental benefits. The plan is significantly more generous than the single-payer plans run by America's peer countries. The Canadian healthcare system, for example, does not cover vision or dental care, prescription drugs, rehabilitative services, or home health services. Instead, 2/3 of Canadians take out private insurance policies to cover these benefits. The Netherlands has a similar set of benefits. It also excludes dental and vision care, as does Australia. What's more, the Sanders plan does not subject consumers to any out-of-pocket spending on health aside from prescriptions drugs. This means there would be no charge when you go to the doctor, no co-payments when you visit the emergency room. All those services would be covered fully by the universal Medicare plan. This too is out of line with international single-payer systems, which often require some payment for seeking most services. Taiwan's single-payer system charges patients when they visit the doctor or the hospital, although it includes an exemption for low-income patients. In Australia, people pay 15% of the cost of their visit with any specialty doctor. The Sanders plan is more generous than the plans Americans currently receive at work too. Most employer-sponsored plans last year had a deductible of more than $1,000. It is more generous than the current Medicare program, which covers Americans over 65 and has seniors pay 20% of their doctor visit costs even after they meet their deductibles. Medicare, employer coverage, and these other countries show that nearly every insurance scheme we're familiar with covers a smaller set of benefits with more out-of-pocket spending on the part of citizens. Private insurance plans often spring up to fill these gaps. In Canada, for example, vision and dental insurance is often sponsored by employers, much like in the United States. The reason they went this way is clear: it's cheaper to run a health plan with fewer benefits. The plan Sanders proposes has no analog among the single-payer systems that currently exist. By covering a more comprehensive set of benefits and asking no cost-sharing of enrollees, it is likely to cost the government significantly more than programs other countries have adopted. Would Sanders's health plan lower American health spending? It's hard to tell. One of Sanders's main arguments in favor of his health care bill is that American health spending is out of control and single-payer would rein it in. There are certainly policies in the Sanders plan that would reduce American health care spending. For one, moving all Americans onto one health plan would reduce the administrative waste.